we've been working together really for about 2 or 3 years now, haven't we, on a research project, 2.5 years, that's been looking at improving hospital discharge arrangements for patients who are homeless, and in particular trying to sort of, we've been evaluating a programme that would try to stop discharging people to the streets, because when the research started, up to 70% of homeless patients were being discharged onto the street, and this study has looked at a number of services and schemes that were set up to try and prevent that from happening. It was a really important topic because I think to see the reality of it and to be, so close to what's happening, it really gives you the passion then to want to change things, and through the research is very important because that's telling the story, but it's also collecting the data to show that this just wasn't an isolated incident, this was happening to a lot of people, but then through the research to sort of evaluate really good schemes, which in some areas Joe's experience wasn't the case. It was people were moving out of hospital into a residential step down unit, and through the research we were able to show things like that was very cost effective, so that discharging to the street is a false economy. It's not only inhumane, but here's the evidence to say to commissioners, well, there is an alternative way.
It's like when they discharge you, you're still not fit enough. Well, so then a week later you're bouncing back into hospital with the same complaint, but now you've got something else on top of that as well because of where they discharged you to the street while you're unwell. And it's just a vicious circle that goes round and around in circles, and they're just bouncing back from the street to the hospital, from the street to the hospital all the time.
So the main thing we want to see really is for older people, we don't discharge older people to the street. We have some really good services called intermediate care step down, and it's really just making sure that those services are adapted and that they're accessible to people like Joe and to people coming out of hospital. I think one of the problems with homelessness is it's assumed to be just a housing issue, that we'll signpost Joe to the housing and they will sort her out, but we don't see that it's got all these health needs, and it's a much bigger issue. And I'm grateful to Joe, because after the study you've joined the advisory group for the project and been a real part of the project. Patient and public involvement is so important in going out to commissioners, and it's not just me telling the story, but it's more powerful coming from you, so it's very much a partnership approach.